Since day one, the Trump administration has been rolling out its vision to make America great again. And part of that mission includes the appointment of Health and Human Services Secretary Robert F. Kennedy Jr. and his initiative to get our country healthy again. Joining us to break down how this could affect everything from our food supply to health care and more is Dr. J.P. Saleeby, Medical Director for Carolina Holistic Medicine. So good to have you back.
Great to be here.
So we're talking about MSCHA. So I'll let you tell what the acronym is all about.
Yeah, so MSCHA is Make America Healthy Again. It's something that Bobby Kennedy was talking about prior to the election even. And a lot of us were gunning for his appointment to head HHS, which he did get approval with some drama involved during the hearings, but he came through, and so many of us in my circle, a movement formerly called the FLCCC, now called IMA, Independent Medical Alliance, we're pushing for some changes in healthcare across a broad spectrum of things.
And that's exactly what he's trying to do on the Hill in terms of taking another look at over-prescribing things like Adderall to adolescents, eliminating seed oils from our food supply, food dyes, all these things that could be contributing factors to the nation becoming less and less healthy.
Right, contributing to chronic illness.
Chronic illness.
So it's broad spectrum. I mean, it can't be just a focus on one or two things. This is something that's been going on for 75 plus years. And it starts with the very basic, simple facts that our diet and our nutrition took a major hit, especially after the Flexner report and the closing of many schools, naturopathic, chiropractic schools, with a focus on allopathic medicine, which is now, you could say, captured by pharmaceutical industry. So we have to undo all that damage. We have to take that food pyramid and change it. We don't want to, say, flip it upside down, so folks in our group of senior fellows are talking about a food tree, kind of give a different description.
Doesn't have to be radical.
Right, not
just
radical,
common sense.
but common sense stuff. You know, take some of the toxic things out of our diet. The glyphosate residue from Roundup that's permeating all of our wheat and cereals. And, looking at better choices of oils. Fat is not bad, but there are some good fats.
And I think some fast food chains, or at least one that I'm aware of, is committing themselves to using beef tallow.
Tallow, right. I just did a big dive into tallow, and I'll have a talk coming on with that topic. But yeah, tallow has some saturated and monounsaturated fats that are good for you and actually can lower your cholesterol. So a lot of, this would be blasphemy if you talk to, let's say, a traditional cardiologist about animal fats versus vegetable fats.
But a lot of doctors, and this is where you are unique, because not only you straddle two worlds, you're an MD, but you also practice holistic medicine. So you look at it from a completely different point of view. We have doctors in the system that don't take a single nutrition course. They're not required to in order to get their license and to start seeing patients.
That's correct.
And nutrition is the very foundation of life.
It is, and can eliminate, just dietary changes can eliminate a lot of chronic illness, and we'll see the disappearance of obesity, diabetes in children. Now we're projecting large numbers if we continue the course we're going. So that's one of the IMA's recommendations to the HHS secretary is, Bobby, hey, let's re-examine our food pyramid, our food tree.
Is there a point in time in this country that we were particularly healthy? We went through the Great Depression, we dealt with food shortages, we had scarcity. And then was there a time, kind of a golden period, before we started bringing in all of this over-processed foods into the system?
Yeah. So it's funny, during the Great Depression, it was forced intermittent fasting. Okay, that's tongue-in-cheek. Okay, I'm joking about that. But yeah, our dietary intake, caloric restrictions during times of when the country was, under pressure. But we saw a change after the food pyramid was developed, and kind of we went down the wrong path, if you will. And then with the pharmaceuticals, piling up, Polypharmacy is an issue, like too many drugs.
Yeah.
But you know, I think with the over-processed foods, that was a bad turn. So we have to undo that.
So do you think like the 60s were sort of the last bastion of health?
Say late 60s. If you look at the
Yes.
Apollo 11 launch
Uh-huh.
and look at all the people lined up on the beach, they're all thin,
Yeah, I know.
healthy, fit looking.
I know.
And if you go out to the beach today and take a look at the folks lining up, you know, sunbathing, it's quite a different body habitus, right?
Well, you know, and it's not just body shape or size, but it's truly what is happening internally that is manifesting itself externally.
Sure is.
But I'm really interested to learn what's happening right here in South Carolina. So we've kind of given an overview of what's happening up on the Capitol in Washington, D.C., but you're going to be joining us next week to talk about right here in South Carolina how we're going to make this state healthy again, and I can't wait.
Awesome.
Thank you so much, Dr. Saleeby. We'll be back after this.